I'm going to start the discussion for mental health, and it refers to Chapter 9 of our text. And there was an extra reading, cross-cultural primary care, a patient-based approach, and then there were a couple of videos also in the reflection for this section. So prior to reading all of this material, I didn't really make the connection that there was such a big difference in how culture influences mental health, but there is a relationship, and it tends to influence how a person perceives mental and physical health, and how culture shapes society's views of mental health, and then how treatments and diagnosis happen. And cultures vary in terms of how they define mental illness, how they handle it, how they cope with it, how they treat it. And then some cultures even have cultural specific illnesses, which is defined in the textbook as cultural bound syndromes. And I thought that was really interesting. I didn't really realize that was such a big thing. And like an example I can give you was the Japanese culture, and the syndrome name I can't pronounce, but it's abbreviated TKS, and it's characterized by an excessive fear and anxiety that a person will behave in ways that will embarrass or offend other people, and it results in social withdrawal and like avoidance. And it's linked to the culture because the Japanese culture places an emphasis on not embarrassing others, and they have deep concerns with issues of shame. So I thought that was really interesting. And another part of the chapter that I thought was really interesting was the coping part, and it's also part of the discussion questions. But in the text, and it's not only how culture affects coping, but it's also how coping changes with age. And the example given was like the Chinese culture and how they handle stress. They look at stress as an opportunity to grow, and I think in comparison, in some cases, maybe most cases in the United States, stress often leads to depression. So it's quite the opposite here. Not that that happens in all cases, but I think that it's kind of the total opposite, which I thought was really interesting, because stress, I think, is more of I think it can occur in any culture, for any reason at any time, but it's definitely handled differently. So another part of the discussions was how culture and immigration can affect mental health. And I connected this with the reading. When someone comes here and it talks about acculturation in the textbook, and that's something that we're going to talk about in our reflection 10. And the acculturation occurs when a person adopts the cultural ways of the new culture in order for them to function better in the environment, but they don't completely conform to the new culture. And like I said, I associated this with the reading because I think that when a person comes in from a new culture and they have their own beliefs regarding these things about mental illness, coping, and defining and diagnosing and treating kind of thing, and you have a child or a healthcare provider who's trying to help them, it can make it really difficult. So this patient-based approach, from what I understand from the reading, is kind of how they ask questions to get to the bottom of the issues, and then how they understand the issue and then determine what's going on, and help them, provide them with the best treatment options that they can treat them while respecting their own beliefs. And then another part, it talks about going through the lifespan, and how mental health in childhood is often viewed as disorders such as ADHD, autism, that type of thing. And then as you progress into adolescence and you have all these hormonal changes, and the expectations and norms of society and culture start to play a larger part, you have the issues of your eating disorders, so your anorexia and bulimia, and how the book talks about how, you know, the culture influences this because of how they view it. Like, it gave an example of a culture who force feeds women because large women are more desirable, yet like in more of a Western culture, thin is more of what's accepted by society. And then as you get into adulthood, you know, you've got more depression because, you know, things change as your priorities change, the expectations of you as an adult change, and that kind of thing. So, you know, then you have those mental health issues to deal with. And then as you get even older, you know, then you're dealing with, you know, probably more illness as you get older, which can be very stressful, you know, dementia, Alzheimer's mentioned, and the difference in coping at this is in older age. The book talked about how people who are older age look to coping as they look at the people that surround them, their, you know, spiritual leaders, their family, and that sort of thing, to help them cope with their aging mental health illnesses. So I think that I answered all of the questions in the discussion. Another, just something I wanted to throw out there that's was kind of in the news, and that it was discussed in the end of the chapter, and it's kind of a controversial topic, but the good death that's talked about on page 266, and it says, a good death is characterized by dying after a long and well-spent life, after having resolved arguments and conflicts in the company of loved ones without pain, and while at peace with one's own death. And how cultural norms about this belief of good death vary greatly, and it depends on the depth and the content of their beliefs and their individualistic or collectivistic orientations and the time it takes to die. And I associated with that girl, Brittany Maynard, that chose her death because of her, I believe she had brain tumor. So, and I just wonder what people thought about, you know, in our society, because we're individualistic, I think that, you know, there is more of this push to emphasize, you know, one's choice to die, or, you know, I wonder what, like, your views were or thoughts are on that, because I feel like we've not quite crossed the line. We are an individualistic society, and we place value on our own personal choices and stuff like that. But yet, her choice to do that caused a great controversy among a lot of people. So I just wonder what everyone else's thoughts were on that. So that would be my question for this section of the chapter. But thanks for listening. I hope you guys comment.